You're watching the award-winning GHS-TV, a nationally recognized student television station.
Hello, and welcome to this week's edition of GHS-TV's award-winning talk show, Crosstalk. I'm your host, Jamaia Chase. Each week in this time slot, we take a look at different issues, personalities, and events that affect you and our community. In the U.S., 1 in 8 women will be diagnosed with breast cancer in their lifetime. Thankfully, progress is made every year in research and treatment, increasing the survival rate for women. With us today for our first segment is Pam Winter, a breast health specialist at Baptist Women's Health Center. Ms. Winter, thank you so much for joining us today.
Thank you for having me here, Jamaia.
I would like to start off talking about some of the warning signs or symptoms of breast cancer.
So most of the time there really aren't any warning signs, and that's kind of the tricky part. Certainly most breast cancers are not painful, so we don't think about having any particular type of pain. But the things to watch for are just any changes in your breasts. So that's why breast self-exam is important, to make sure you know your own breast tissue pattern. Look for changes like changes in color or texture of the skin, dimpling or puckering, changes in the nipples. But most of the time we can find things sooner than we can see them or feel them.
Well, are there any symptoms that are overlooked that people should pay attention to?
Probably some of those people might not always think about. Color changes in the skin or even lumps under the arm sometimes should be checked out.
Well, while breast cancer is typically associated with women, men can develop it as well.
Absolutely. So 1 in 8 women, as you mentioned, will get breast cancer. 1 in 1,000 men get breast cancer. So it's very rare for men, and that's sort of a red flag sometimes if we see a man with breast cancer.
Are there symptoms similar for women and men?
You know what? They're just the same. The symptoms are the same and the treatment's the same for men and women.
Well, what are some of the preventive measures that men and women can take?
So a lot of the risk factors are things that we don't have control over, but there are some things that we do have control over. So preventative things are things like making sure that you get your regular screening, your regular health care checkups, and especially the things that get overlooked for prevention are the lifestyle factors. So alcohol consumption, weight, exercise, diet. My goodness, those are important for everything about our health, so it makes sense that we would do those things to help lower breast cancer risk as well as stay healthy.
Well, you just mentioned checkups and mammograms, so when should women start getting them?
So there is a little bit of controversy about that sometimes, but at the Women's Health Center we still say that women should start getting mammograms at age 40 and get them regularly as long as they're still in good health. But the important thing and the direction that we're going these days in everything with breast cancer diagnosis and treatment is individualized care. So certainly it's a discussion for a woman to have with her doctor, and that's going to be partly based on personal risk factors. So the average woman starts about 40, but there may be women who need to start sooner if they have a family history of breast cancer or certainly have other personal risk factors. They may need to start sooner. Women who have breast cancer in their family probably should start their screening about 5 to 10 years younger than the youngest person in the family was diagnosed.
Well, let's move on to treatment. What are the different options for patients?
My goodness, we've gone a long ways with that, but it still kind of comes down to the 3 main things are surgery to get rid of the tumor, usually some radiation to get rid of any cells that may be lingering behind that we couldn't see, and sometimes chemotherapy, because chemotherapy is systemic therapy. It goes all over the body in case there's a chance that the cancer has spread, and that's going to be, again, very individualized on what's going on with that particular person's cancer.
How involved are the patients when they determine their best treatment route?
So the patients are very involved. They'll meet with a whole team. So sometimes people think you go in and meet with one doctor and all the decisions are made by the doctor and they tell you what you're going to do. But you usually will have a team of a surgeon, a medical oncologist, and a radiation oncologist. And each of those physicians is offering you options for care, and they like the patient to be involved. I think the good thing is that most cancers are diagnosed very early, so there are lots of options. Sometimes the downside of that is then the patient is left with trying to make decisions about what to do.
Well, can men receive the same treatment as women?
They do. They actually receive exactly the same treatment. Even if they have a hormonally based cancer, will get hormone blocking drugs just like women.
Well, it seems that more and more young women are being diagnosed with cancer at the age of 20. Is it because we're aware of the symptoms now, or is it because of something else?
That's a good question. I think that certainly we are seeing a lot of women under 40 at least being diagnosed with breast cancer. I think awareness certainly is a big thing because we talk about it much more openly than we used to. People are aware, they get screened earlier. People are more aware of knowing their own bodies and finding things earlier. So I think it's kind of a combination of maybe we are seeing increasing numbers in younger populations, but probably a lot of it is awareness.
Ms. Winter, I read that breast cancer before the age of 40 differs from breast cancer faced by older women. Can you explain?
Sure. Well, I think, again, we look at cancer on an individual basis more and more often because there are so many kinds of breast cancer. They all have different features. They may respond better to some things, and fortunately we have ways to figure that individualized care out. But certainly younger women we know tend to have maybe more aggressive cancers. They also are dealing with a lot of different lifestyle things going on. That's usually when they're younger and raising their families and making career decisions, so they have a lot of those factors, psychosocial factors too, that enter into their treatment. They also have a longer time to live, so we have to worry more about what future risks are.
Well, are there any advancement in breast cancer research or treatments that you are most excited about?
Wow, I'm so excited. I've been in oncology for a very, very long time and I've seen so many incredible advances, and especially in the last few years. Certainly we know so much more in the genetics field than we used to. We know about a lot more genes besides BRCA and are learning how those affect not only breast cancer but also other cancers. So learning more and more about that, testing more people to find out who is predisposed to cancers. Certainly new surgery methods, individualized care with oncology drugs, learning more and more oncology drugs, and even predictive tests that help us to know exactly the best way to treat each woman as an individual. And advances in radiation. We're getting more and more radiation options that many women now have. If they have early cancers, have options for shorter periods. Baptist is one of the innovators in the area in intraoperative radiation therapy, which means some women are actually eligible to receive their one-time radiation treatment in surgery. So the tumor is removed and the radiation oncologist comes in and delivers that radiation, and that saves them from the 4 to 6 weeks of radiation that they may have sometimes had in the past.
Ms. Winter, this was such an informative discussion. Thank you so much for joining us today.
Thank you for the opportunity, Jamaia.
When we come back, we'll talk with an organization that not only supports, but offers encouragement to women battling breast cancer.
GHS-TV started in 1982, and it was just a couple of cameras, a couple of on-air personality, and it's really grown into what you see today. It's a multi-million-dollar studio with top-of-the-line technology.
Being able to operate, all of the machinery in the control room, being able to use all of our software and hardware that we have around the studio is a great skill because this is top-of-the-line equipment.
I feel like this class has brightened my horizon. It's something that I never thought I would be doing, especially as a student.
GHS-TV is probably one of the most hands-on experiences a student will ever get in their lifetime.
Welcome back to Crosstalk. Nothing really has just the vibe that we have here.
Especially after you finished, you get a real rush of, wow, I just did that.
By the time a student graduates from Germantown High School, they will know pretty much every position there is, from producing to directing to on-air work.
You learn time management, you learn organization, you learn how to work with people, how to better communicate with people.
We put a lot on them, and they have to be able to have the responsibility and the knowledge to get everything that we ask them.
I had very little experience, so in the past 3 years, the skills that I've learned have absolutely exponentially grown.
The class has actually helped me figure out that I want to go to college for journalism.
When a student graduates, they are the best possible version of themselves that they can be.
Thanks for tuning in. We'll see you tomorrow.
For more information about the Kappa program, visit ghskappa.com or call 755-7775. You're watching the award-winning GHS-TV, a nationally recognized student television station.
Welcome back to Crosstalk. Every 13 minutes, one woman in the U.S. will lose her life to breast cancer. One of the biggest organizations to raise money and research and awareness to combat this is the Susan G. Komen Foundation. With us now is Elaine Hare, the CEO of the foundation's Memphis Mid-South Mississippi chapter. Ms. Hare, thank you for joining us today.
Thank you for asking.
Race for the Cure is one of your biggest events of the year, and it's coming up. When and where is it?
October 26th, downtown Memphis at AutoZone Park.
How many participants are you expecting this year?
At least 7,500.
Well, you have a lofty fundraising goal. Can you tell us how you determine the goal each year?
Well, we base it on the need. We could have a goal that's 3 times what we established because the need in our community is so high. So we want an achievable goal, though. So we divide it up 3 ways. Third is from corporate sponsorships, third's from registration, and a third's from donations.
Well, how was the money raised, and does any of it stay in the Mid-South area?
75% of everything we raise stays right here at home. The other 25% funds breast cancer research.
Well, Race for the Cure have thousands of people every year. Can you tell us how the race began?
Well, it began actually at a friend of mine's kitchen table. Molly Meisenheimer was diagnosed in the early 90s, and she had young children. And so some of her friends gathered together, and they said, we've got to do something about this. Meanwhile, Nancy Brinker, whose sister was Susan G. Komen, had died from breast cancer, and she had formed the Susan G. Komen organization. And so my friends, Molly and Emily Keplinger and some other nice young ladies, got together and founded our local Race for the Cure. This will be our 27th race.
Well, how has this organization evolved over the years?
Well, originally we just served a small area, and we had, we thought we were going to be lucky to have 170 people at our first race. Our largest race has been 20,000 people. But the most important impact is, since 1993, we have granted almost $11.3 million to local health care and education grants right here in the Mid-South.
Well, what other fundraisers do you hold throughout the year?
We do things like we're having a movie night tomorrow night, 5. It's a private screening with the actress Jennifer Goodwin, who's from Memphis. And we have Rock the Ribbon in the spring. We have different events like one car dealership's going to have a drive for Komen all October. So just go test drive and, you know, we earn some money.
Can you talk about the outreach you do with your community grants?
Yes, we pay for the screenings and mammograms that are so important. For those who are uninsured or underinsured, we fund that. Also, a big challenge is a diagnostic. If you have a basic mammogram is called a screening. So if you need more detailed, meaning an MRI or an ultrasound, and you have insurance but have a high deductible, even with insurance that can be $1,100. We have grants that will cover that fee so that you can get the health care you need when you need it.
Well, can you tell us about the treatment assistance program that you offer?
Yes, that is something through our national program. We also have a local grant with some local surgeons. So if you need a biopsy and you don't have insurance, our grant will cover it.
Ms. Hare, how can people get involved with the Race for the Cure Foundation?
Well, we have a website, KomenMemphisMS.org. You can volunteer, you can register, and you can donate. All of those things are very important.
Can you talk about all the different ways this is beneficial to the cancer patients?
Sure. It's actually, as survivors will tell you, the mammogram is the first step to diagnosis, so we help save lives. And you get to hear the stories from the survivors. We actually have somebody right now whose company is a sponsor for the race. And we were meeting, and her boss was kind of like, you know, we get so many requests, and she finally looked at him and said, when I was between jobs, Komen paid for my mammogram. So it's not just people we don't know, it's our friends and neighbors.
Tell us about some of the work you do for the program specifically.
Well, we have major education programs. One is called Hope Up, and it's a support group for those women who have metastatic breast cancer, and they meet once a month, the last Sunday of every month at our office. And it's led by Pat McCree, who has NBC, and Mindy Abernathy, who's a survivor and a oncology RN. We also have Blossom Within that we do with Baptist, which is for women in current treatment. Because once you're going through cancer treatment, sometimes it's really tough when you don't look like yourself or feel like yourself. So we have this program for them to inspire them and to make them feel and know how beautiful they are within. And then we have major education materials, Pink Sunday, where we reach over 10,000 individuals, and we focus with the African American churches in Memphis. And this is our 5th year.
Well, Ms. Hare, thank you so much for joining us today.
Thank you for having me.
For more information about the walk, please visit KomenMemphisMS.org. Stay put. When we return, we'll hear firsthand how breast cancer affects a patient mentally, physically, and emotionally.
We have 4 major vocal ensembles at Germantown High School. There's a large chorale with about 50 to 60 students, a women's chorus, our chamber choir, which is an elite ensemble of 18 singers, and a contemporary a cappella group, which is about 16 singers.
It's really nice to be in a room full of people who share your passion and who want to learn and make every song as beautiful as it possibly can be.
I really try to instill in my students the importance of connecting with the literature, that they have to go outside of the box and actually understand what they're singing about. Thank you.
This program has really pushed me. It's shown me a lot of my insecurities and how to grow past those.
Many times we'll gather around the piano to build that sense of camaraderie, to be able to hear each other better, to interact with each other and make music together. Work together, hold that solid. Go.
Then we genuinely love music. We sing because we want to and not because our Mr. Hayner's telling us.
2 beats, you come in. 1 and 2. Music empowers us to come together as a group. I feel like this generation has become so focused on me, 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 me. And music is us, 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 us.
For more information about the Kappa program, visit GHS-Kappa.com or call 755-7775. You're watching the award-winning GHS-TV, a nationally recognized student television station.
Welcome back to Crosstalk. I'm your host, Jamaia Chase. While every year 200,000 women are diagnosed with breast cancer, every survival story is different. And we are so honored to have Jennifer Winstead on the show to share her story with us. Ms. Winstead, it is a pleasure having you on our show today.
Thank you, Jamaia. I'm glad to be here.
Breast cancer is one of the most known cancers in the world. When did you first suspect that something was wrong?
Well, I was 39, and this was back in 2014, and I actually found a lump myself and thought that it was unusual. I had not noticed it before, mentioned it to my husband. We weren't too concerned. I wasn't at the age yet where they were saying mammograms might be necessary, but I did go ahead and call my OBGYN, and after seeing him, he suggested that I go ahead and get started with a mammogram.
Well, I see that you started treatment right away. What was your initial reaction to the diagnosis?
I think anytime you get a cancer diagnosis, especially maybe at a young age, it's an overwhelming feeling. Not really sure what to think, but it was definitely something that I tried to just take one step at a time and one day at a time and not get overwhelmed. And I did feel very fortunate that they have come so far and that I had a lot of different options for my treatment, and especially targeted therapies that maybe hadn't been available 10 years before.
Well, did you do any research to prepare yourself, Ms. Winstead?
I did look at a couple of things online, but then talked to other people. That was probably the main thing. I talked to a couple of other young people who had been through something similar, and I know everyone's experience is unique, but it was helpful to speak to someone else who had been through something like that at a young age.
Can you talk about your support system through that time with family, friends, or colleagues?
Absolutely. I'm very fortunate to have my parents and my sister live in the same town. My husband, and at the time I had a third grade daughter, and so we were very honest and upfront with her throughout the whole time, and she was very aware of what was happening. I am a library director at St. George's Independent School and had a wonderful support system from colleagues, from families, and it was just unbelievable the way people reached out to support us during that time.
Well, we are happy to report that you are in remission. Do you still go back for checkups?
I do. I just graduated. I used to go every 6 months, and before that I think it was every 3 months, and now I go once a year.
Can you tell us the importance behind keeping up with your health?
I think it's just important to be aware of your body, and like I said, I did notice the lump myself, and it was something that I could have easily ignored, but something about it just didn't seem right, and I'm glad that I went ahead and had it checked out.
Ms. Winstead, you are the honorary chairman for this year's Race for the Cure event. How has this annual event impacted you?
Well, I've been a part of a Race for the Cure team since 2002. St. George's has always been a big supporter of Race for the Cure and had teams. And I remember when it was in Germantown, it was just so close down the street from the school. But I think it's so important to be able to give back to our community and help others. And it has been an important thing in our family. You know, I participated long before I knew that it would affect me. And of course, we had family and friends who've been affected by breast cancer before that, but then all of a sudden it's very personal.
What do you want people to know about Breast Cancer Awareness Month?
I guess I want people to know that there are resources available because of places like Susan G. Komen to help you, and also just to be aware and help other people in your community be aware that there are places you can turn to for help.
Ms. Winstead, what support system do you feel is missing for cancer patients?
I don't know if I can think about what be missing, but I would say my surgeon has put me in touch with several other young people. She would call either me or my husband and say, would you be willing to talk to someone young that was just diagnosed? And we have definitely reached out and done that. And so maybe that could be part of a formal thing, but I've been happy to reach out and speak to people about my experiences.
Well, what is some of the advice you would give cancer patients?
I think my advice would be not to read too much on the internet. Listen to people that you trust and respect, and also just to take it one day at a time and not to get overwhelmed. I think my family was surprised at how calm, cool, and collected I seemed throughout the process. Not that you didn't have moments of tears and freaking out and why me, but through most of it, I was just like, okay, what's the next step? What are we doing next? Maybe that's because I'm a teacher and I like a plan, but I think not getting overwhelmed and just taking it one step at a time is the best advice I can give.
Ms. Winstead, thank you so much for sharing your story with us today. We really appreciate it.
Thank you for having me.
I would like to thank my guests one more time for joining us on today's show. They were truly informative and eye-opening discussions. It helped me remember that while breast cancer may have started the fight, we will finish it. For more information on our programming, please check us out on the web at GHS-TV.org, where we are streaming live 24 hours a day. You can also check us out on Facebook and Twitter. I'm Jamaia Chase. From all of us at GHS-TV, thank you for watching Crosstalk, and I hope to see you again.